Hello! Thank you for joining me on this presentation on value-based purchasing, the Hospital Outpatient Quality Reporting Program. This presentation is intended for all allied healthcare professionals. The purpose of this presentation is to educate allied health professionals on what exactly value-based purchasing is. We're going to be closely examining the Hospital OQR VBP. This is especially relevant to individuals working in the HIM field, but it's beneficial for all healthcare employees to have an understanding of what VBP is and how it affects the delivery of healthcare. Our learning objectives for today include: what is VBP? What is the purpose of the Hospital Outpatient Quality Reporting Program? What measures are considered in this program? What information is required to be reported and by who? What incentives or penalties are associated with this VBP? And how has the Hospital OQR impacted healthcare in the U.S.? So you might be wondering, what exactly is value-based purchasing? So this is also known as pay for performance. And according to the CMS, value-based programs reward healthcare providers with incentive payments for the quality of care they give to people with Medicare. These programs are part of our larger quality strategy to reform how healthcare is delivered and paid for. Value-based purchasing is essentially a plan to raise the levels of healthcare quality and value that an individual receives by rewarding the healthcare providers who provide the best quality of care, while essentially penalizing the hospitals who provide the lowest quality of care. In the long run, VBP programs provide better care for individuals, better health for populations, and lower healthcare costs. The Hospital Outpatient Quality Reporting Program is a pay-for-reporting program which collects quality measure data from short-term acute hospitals paid under the Outpatient Prospective Payment System for care provided in the hospital outpatient departments. This program provides a financial incentive to healthcare providers to track and report their quality of care data. In turn, the Hospital OQR program provides the data to CMS that CMS uses on their Care Compare website. From this website, Medicare beneficiaries can make decisions on what hospitals and providers they will go to based on the rankings of their quality of care. Essentially, the Hospital OQR program exists to promote higher quality, more efficient healthcare for Medicare beneficiaries through measurement. So what measures are reported on? Well, an outpatient is typically an individual that receives treatment from a medical facility and isn't admitted to the hospital. Services are usually provided, and the patient leaves the same day. CMS collects data on specific areas, such as quality of care for emergency department visits, stroke care, imaging efficiency, outcome measures, and amongst many other measures. The measures in the Hospital OQR program collect data derived from various methods, including chart abstraction, claims information, web-based entries, and surveys to measure aspects of patient care, such as outcomes and processes, patient experience, patient safety, care transitions and coordination, and ED efficiency. And here to the right, we can see some measures that are recorded. We're going to be specifically considering OP39, breast cancer screening recall rates. So the description is that this measure calculates the percentage of mammography or digital breast tomosynthesis screening studies that are followed by a diagnostic mammography, diagnostic DBT, ultrasound of the breast, or magnetic resonance imaging of the breast occurring on the same day or in the 45 days following the index screening study that's performed in an outpatient or office setting. OP39 aims to promote the use of high-quality, efficient care, reduce unnecessary exposure to radiation and contrast materials, ensure adherence to evidence-based medicine and clinical practice guidelines, and provide data to consumers and other stakeholders about imaging use at the facility, state, and national level. So there is an equation used here, and this looks pretty wordy. So what exactly does it mean? Well, the top number, or the numerator, is the number of exams that Medicare beneficiaries needed follow-up imaging for within a certain period. And the denominator, or bottom number, is the number of exams that Medicare beneficiaries received at that facility during that same specified period of time. So the interpretation is that if a facility's score is lower than 5%, that facility may be missing cases of cancer. If their score is above 12%, the facility may be recalling too many Medicare fee-for-service beneficiaries for follow-up imaging. So let's look at one hospital in particular. This information can be found by looking on the CMS Care Compare website, and you can search by location or hospital. Select the Quality tab to see the reported information for various measures. So at Alexian Brothers Medical Center, for OP39, their rate is 6.3%. So percentages between 5 and 12% are best, so they're right in the middle. So how do hospitals report this data? To participate in the Hospital OQR program, hospitals must register on the CMS HQR website and obtain a HARP account. Before beginning to report data, they have to identify and register at least one security officer and then submit their data. So submission of any hospital OQR program data indicates the hospital's status as a participant in the program, even if they only submit data on just one element. CMS has established quarterly deadlines for hospitals participating in the Hospital OQR program. So, what are the incentives and penalties of this program? Well, hospitals that do meet the requirements will receive their full annual payment update. However, if a hospital fails to meet the requirements, they will receive a 2% reduction to their APU. This reduction is calculated by applying a payment adjustment rate of 0.980 to the Medicare OPPS payments and co-payments that the hospital receives. If a hospital didn't meet the requirements, they do have the option to submit a request for reconsideration. What's the impact to healthcare? By incentivizing the quality of care, rather than focusing on the quantity of services provided, this program encourages better patient outcomes. This program has also led to increased transparency for healthcare data for patients, allowing them to make more informed decisions for their healthcare. By utilizing the Care Compare website, patients can have realistic expectations and be able to select the best care for their situation. Because the Hospital OQR program generates data across a wide variety of measures, providers and hospital administration can identify healthcare trends and systemic issues. By tracking data on specific measures, this informs hospitals of the areas where they should focus their performance improvement efforts. So in conclusion, can you define what VBP is? What's the purpose of the Hospital OQR? What measures are considered in this program? Can you describe what information is required to be reported and by who? Can you list the incentives or penalties that are associated with this VBP? And can you explain how this VBP has impacted healthcare in the US? Time for a quiz.